Will the Committee of Supply please come to order? This section of the Committee of Supply will now resume consideration of the estimates of Executive Council. As previously announced, as there is only one resolution, the discussion will proceed in a global manner. The floor is now open for questions. The Honourable Leader of the Official Opposition.
Thank you, Mr. Chair, and good morning to everybody. I just want to put on the record as a father to two teenagers, I'm very overjoyed today at the announcement that children 12 and up will be eligible for the vaccine, and so certainly just working the phones, trying to arrange for my kids to get in there, and trying to spread the word to other parents and families across Manitoba so we can get this vaccine program accelerated to the top speed. So I just want to acknowledge that first and foremost. With that in mind, I know the vaccine program is a significant part of our pandemic response. At the same time, we're seeing those high numbers continue this week. It looked like we had a few days of a little dip, but then maybe that was just noise, because yesterday we still saw another higher number. So just with that overall context in mind, just wanted to ask the Premier, what's the state of play right now? What are the steps, the measures that are being taken to respond to the high cases and test positivity we've been seeing recently?
The Honourable First Minister.
Yeah, first of all, no, I need the complete vaccination scorecard, the complete vaccination report, because I can share that with the committee. Yeah, okay. That was out, wasn't it? Or does it only come out at the end of the week, Dave? Do they only release it at the end of the week, or is it out now? Thanks, Mr. Chair, and yeah, likewise with our daughters, our older daughter just received her vaccine, very excited about it, and our younger one just made her appointment too, so I share that enthusiasm around our family as well, and I know many families do, and I think it highlights the critical importance of making vaccine available, but also promoting among some of those who might hesitate or be wary of getting a vaccine, helping encourage them. I've just asked to get a document that I'll share with the committee members on some of the specific aspects of the vaccine awareness and outreach strategies, so I'll make my comments around other aspects of this, but just suffice to say that the member's quite right in pointing out the vital importance of getting needles in arms. There's been challenges, all over the world, of course, but right across the country of various kinds throughout the pandemic on the vaccine strategies. For us in Manitoba, we were quite heavily criticized early, our vaccine team, and of course through the vaccine team, my government, for not having enough people vaccinated. Interestingly and repeatedly with misinformation in one publication in particular. And the challenge was, of course, that here in Manitoba, we stayed longer following the manufacturer's recommendations than most other jurisdictions. The manufacturer's recommendations initially said that you wanted to get that vaccine in arms, and it depended on the specific vaccine, but 3 weeks later. And so we took that to heart, held to that. Our vaccine team felt that was the right strategy to follow. And as a consequence, initially, it looked like our vaccine team wasn't doing a very good job because there were fewer people getting it, but the truth was more people were getting it for the second time. Those people were our frontline workers, in particular who work with vulnerable Manitobans, and our seniors in personal care homes. And we've continued with that approach. The vaccine team has continued with that approach in respect of vulnerable communities. In particular, I'm very proud of the work that the Vaccine Committee has done in cooperatively developing immunization strategies with our First Nations leadership. I think you know, there'll be lots of time for retrospective after we're through this, but I think during it, many people have noticed how effectively the immunization, First Nations immunization team has worked, how effectively the vaccine team has worked with them and this is particularly important in Manitoba because highest outside of the territories, of course, highest percentage of First Nations residents, many in smaller communities. Close contact is inevitable for most in those communities, and so the risks were high, and we saw that early in the pandemic, acted on it, and I was able through some lobbying work to obtain a significant number of additional vaccines, which were Moderna, which are the ones, of course, that don't need to be you know, super frozen for a long period of time, so you can get them north. And we got them up there, and it's really helped. Now nothing's perfect. There've been numerous cases, obviously too numerous in the north as well. But third across Canada today in total doses. Our vaccine team's catching up, and that's tremendous, and I think a real tribute to them.
The leader of the official opposition.
Yeah, I think we all want to see the vaccination campaign succeed, and that is, you know, the way of moving out of the pandemic stage of this thing and on to what's next. Perhaps we can talk about that later too. When we're talking about the, I guess, immediate needs before the vaccination campaign really is able to pave that way out of the pandemic, what are the steps being taken now to deal with the ICU capacity and hospital capacity?
The Honourable First Minister.
Sorry, Mr. Chair. There have been a number of steps taken. I'll get into that, but I just wanted to go a little further, if I could, on the vaccine numbers. The member had asked for an update, and I'm waiting for that vaccine scorecard document, because that'll really, I think, all committee members would be interested to know in more detail every aspect of what the vaccine group is doing, and its supportive groups, the First Nations group as well. As of today, 625,404 doses administered. I should just go back for a quick sec and say we had fewer people, different people, getting the vaccine early because we doubled up on the vaccines. Excuse me, sorry, Mr. Chair. Someone down the wrong way. We had more second doses delivered to those seniors and the frontline workers, and we concentrated on our northern efforts, because those were, before we started talking about hot zones, those were hot zones. And so the vaccine team was conscious of the need to get those vaccines up quickly, get them administered quickly, but also make sure that that second dose was available. Since then, NACI, the National Advisory Committee, has changed their philosophy, and this is a lot of, yeah, many times, and some of their communication has been helpful and some maybe a little less so, but the fact remains that it highlights, I think, how dynamic this situation is. You know, situation is changing from day to day on many fronts, and so NACI changed its recommendations in respect of the second vaccine, said you could hold off on it a little longer, a little longer, a little longer. I don't know about the opposition leader. I'm certainly hearing a lot of questions about that second vaccine already from people saying, well, do I have to take the same one? Or I got 70,000 or plus Manitobans had the AstraZeneca. A lot of questions about the AstraZeneca. Oh, thank you. A lot of questions about the AstraZeneca in terms of additional science testing coming back on potential for blood clots, concerns about that, fears about that. So I know the vaccine team has elaborated somewhat on that, and I think there's a plan for them to do even more elaboration in the coming days about their strategies going forward on that. I won't steal their thunder today. I can't, because I know that the plan that they're developing is evolving. But I know the intention here is to get as many people vaccinated as possible and to get as many second vaccines out there as possible, because the immunization doesn't, as much as NACI says it depends on the vaccine, you know. It's somewhat higher than they had originally thought on that first vaccine. I think across the board, depending on the brand, it varies, right? But there is no doubt that that second vaccine is critical. Absolutely no doubt. And were my mom alive, and which she did in her last few years, live in a senior's home, if she had got the first vaccine and then we'd held off for an extra number of months to get the second, I'd be concerned, right? And many families are concerned that in particular, that their loved ones who are older are getting that vaccine as soon as is appropriate. Now, when is appropriate? Well, NACI's decided to change that. So our vaccine team has changed their strategy somewhat. And so not on the over 80s, over 90s, and I may be able, when I go through this, to give you stats on the number of folks who are vaccinated by age category, but the older folks are a high percentage have already got their second dose, which is, I think, great and peace of mind for those who have loved ones who are seniors. Yeah. So 625,404 doses. We're not there yet, but we're getting there. And I think that makes all of us, more optimistic. 536,000 plus first doses, and about 80,000 second doses out there. Approximately 50% of our eligible population. And I'll get into the discussion a little further about where we're going on some of the questions the member has raised with my next response, if you'd like.
The Leader of the Official Opposition.
Thank you, Mr. Chair, and look forward to that information, including the younger age brackets too. We go down to even 40s and 30s and up. But again, I guess the vaccination program is the way out of this thing, but still some heavy lifting required in the interim. So would like to know what steps are being taken with the ICUs and the hospitals in mind, given the high case counts this week and last.
The Honourable First Minister.
Yeah, there's multiple issues here. I'll deal with the specifics the members asked first and then broaden it over into the enforcement side. I think we have some updates on that as well I can share with committee members, because it's both those things. It's dealing with the consequences of COVID. It's also dealing with the causative factors of COVID. Enforcement is an issue as well. And so I'll get to that, but I wanted to, because the member had asked for this. Efforts have been focused on ensuring diligently in preparation and now in implementation, upgrades in terms of staffing, supplies, equipment, space as well. Obviously, in an unprecedented situation like this, there's a need to expand in availability in every aspect of ICU, because the ICU demands have, I don't want to say never, but I believe never before, for any significant length of time, has the ICU need been as great. We've been increasing the critical care bed base. We've been scaling up the ICU bed capacity. Part of that was that there were a number of patients who were able to be moved out of ICUs, either home or into community settings or back to PCH settings. That cleared some space. I don't have the numbers right here right now, but we could probably get that for the member. Both Winnipeg and Brandon in particular, of course, have had to be addressed. On nurse staffing, 60 new full-time nursing positions, 2 ICUs, principally here, of course, Winnipeg, HSC, Grace, St. B, and in Brandon as well. On the critical care orientation program, which is a program we introduced early last year in anticipation of additional needs. That critical care nursing program has now got 39 new graduates as of last month. That's the first cohort, and there'll be more coming, and we will appreciate that. All of those grads have been offered full-time positions in our ICUs, and of course will be needed there. In addition, there's an accelerated ICU orientation program that's directed at existing nurse staff that need additional upgrade or training to do the job in the ICU. So a logical step to give them the opportunity to serve in that, because that's where the need is emerging clearly during this pandemic. Patient flow is, and this is where Lynette Siragusa were here, she'd do a much better job of answering this question, but patient flow is a big issue. I alluded to some movement out of ICUs back. That patient flow management issue has become, of course, even more critical as the ICU demands have grown as a consequence of, in particular, the last 3 weeks of accelerating cases. And we all hope and pray that the impact, and I'll get into the restrictions history here in a bit too. If I could have a document, I can outline that. But I won't get the dates right, but we know that we stepped up our restrictions about a month ago, again 3 weeks ago approximately, and I'll get the dates here from somebody. And then of course the ones that kicked in there's additional ones that kicked in this week. The ones that came in 2 weeks ago, Dr. Rusin has said he's very hopeful about their impact. Those were the ones that particularly, they did gear down on retail, and I'll recap it when I have the document. It's because I think it's a point of hope for all of us that those restrictions, which in particular would limit the home gatherings, right? The sort of domestic setting gatherings, which is where a lot of the problems, according to our healthcare experts, are emanating from, that those are going to have an impact, but they don't have an impact immediately. You can't, it's not a switch, on and off switch, it's a delayed impact. And so because of the gestation period of the disease and other factors, it takes time. And so we're all hopeful that over the next few days, the impacts of those more severe restrictions that were introduced a couple of weeks ago will begin to show. And that'll certainly help us here in terms of moving back down that curve. We were late to come to it. And Manitobans deserve the credit for that. I mean, this is not a congratulatory thing is misinterpreted repeatedly by Free Press columnists.
The Honorable First Minister's time has expired. Oh, I had it up for a while, but the Honorable Leader of the Official Opposition.
Thanks, Mr. Chair. Can the Premier walk us through the numbers in terms of what that means? The Premier's mentioned the various, the supplies, medication, equipment, staff, etc., that's going into ramping up the ICUs. Can the Premier walk us through what that means in terms of beds, per facility, if possible, but system-wide, like what's the bed count at right now for ICUs? Where are we going to get with contingency plans, and what's the anticipated need next week, the week following, because we do anticipate obviously a lag, continued high case counts. Yesterday, as an example, means more ICU admissions a week from now, 2 weeks from now, potentially. So yeah, can the Premier just put some numbers to some of that commentary? Where's the bed count at now? Where does it go once these other contingency plans kick in?
The Honorable First Minister.
Sorry, Mr. Chair, I'll try to pay more attention to your hand signals. An old pitcher like me should be able to remember to look for the signals from the... Anyway, I just asked for that information. The member just asked for to be provided to me, and we'll just take a minute. I'll finish by answering the previous question. We'll probably end up doing this rotation a little bit frequently. Yeah. Well, a bit of delay while I get the information. The modeling the member asked about yesterday, I just wanted to let him know, is going to be released today. This is not the first time that the team has released their modeling, but they'll be releasing again today, and it'll cover ICU capacity in detail. So if for any reason I can't get the numbers for the member, they'll be available in the next, what time today? This morning. Sometime later this morning. So the member will have them, but I will endeavor to get them for him. Just to finish on the ICU piece, I mentioned the patient flow. We've expedited placement in available PCH beds. We're fortunate that we had expanded the number of beds over the last few years in anticipation of more need as our population ages. I wanted to again say a thank you to the members of the opposition and the leader of the opposition for supporting us in our efforts to get greater supports for health care in our partnership with Ottawa. This is really appreciated, and it's critical that we're together on this, because every other premier is of the mind, Liberal, NDP, doesn't matter. It's not a political thing, it's a practical thing. We need more support from Ottawa, and historically the support is at its lowest level in modern times. The percentages in Manitoba, last numbers I saw were 21% of our funding for healthcare comes from Ottawa. This is a 50-50 program in its introduction, you know, and slid down to 25, and we were given that guarantee. Just not keeping up to the growing need. There are growing needs. There's new technology. There's an aging population, for heaven's sakes. Just that factor alone means that there is a greater need for care. And the biggest, and I'll ask if I could get the numbers on wait times for various procedures, not just emergency, but for various procedures. I think I should say, Mr. Chair, we commissioned a study. Who was it that did that study? Did an analysis for us of historical wait times across Canada in various categories. I'll share it with the member, and it's very disturbing. The direction we're going as a country, wait times generally are multiples of what they were just 15 years ago in our country, right across the board for any number of procedures. It's shocking. And healthcare should be there. I mean, we have a wonderful healthcare system. Many people will say we have a wonderful system if you can just get into it, right? If you can get the treatment you need. But without a genuine partnership from Ottawa, every province, and other studies have shown, the Parliamentary Budget Office conducted a study and then a review of the previous study, verifying that the fiscal capacity of the federal government is of course far greater than of any province. Any province. This includes Ontario, BC, certainly with the oil problems that used to say Alberta was the most fiscally strong, but they're not anymore. Every province is facing the challenge of a growing healthcare demand, and we're largely asked to do it with less partnership and support from Ottawa than before. So sincere thank you to the members of the opposition for joining with our government and joining with, frankly, all governments across Canada. It's, you know, relatively rare that premiers agree on everything, and in this instance we most certainly do. And so we have made some progress, but we need the Prime Minister to act. And there is no doubt the federal government has faced this COVID pandemic like all of us. They've done their best. In many respects, I think, have been tremendously helpful of provincial governments, and I thank them for that. But this isn't a short-term thing. Healthcare is not a short-term thing. It's a long-term thing, and the long-term trends are really, really scary for Canadians in terms of waits. I'll just add, when my time comes back up, because I can tell the chairman's going to cut me off, I'll just finish on the ICU, and then I've got that additional information the member was asking on the vaccine delivery issue that he had raised earlier.
The leader of the official opposition.
Yeah, I think we've observed that our First Minister and Premier Legault don't always agree on certain issues, and yet on the you know, the health transfers, definitely that's been a shared priority, I think we could say. But yeah, just returning to the ICU numbers, we could just walk through the numbers in terms of where are we at now, what happens with the enhanced capacity with those various staffing, supplies, equipment, space that was mentioned there in a previous answer. Can the Premier share the numbers on the ICU beds available both today and what's projected?
The Honourable First Minister.
Yeah, I've got part of the member's answer, and we're just going to get the full answer for him here in a second, I think. I'll just finish by saying also on the virtual supports with the new technology that the healthcare system is able to utilize in terms of, and there's exciting stuff there, and not exclusively for rural and urban, but in particular for rural and urban folks, to save them a ton of time and to get them closer to actual healthcare services they need through technological capabilities that I am only of a limited understanding. But I can say that it's very exciting. The team has implemented a virtual COVID outpatient support program. And what that does is it enables people to get care in their own homes, rather than having to travel, as was the traditional model, and frankly, very much the model across the country when I speak to other premiers. That's changing. So again, not trying to polish something that shouldn't be polished here. I'm just saying, as we look back, hopefully a few weeks from now, as we look back on COVID, the learnings that we have gained from this horrible experience are things that we can take with us to do a better job, not just in government. I've talked to many people I mentioned yesterday in education who feel that there are some tremendous opportunities going forward to enhance them in their teaching careers. I've talked to people in business as well who have said, well, my actually friend I met through the Portage and District Chamber of Commerce, when the member was, let me think, when the member was 9, I met this gentleman, and he's been in a retail business setting since that time and a few years before. And he said, this whole thing has been a total wake-up call. And I said, what do you mean? And he says, I don't know why we weren't doing home delivery about 20 years ago. He goes, and they really weren't. They were waiting for the customer to come in. So some of the programs that we've, I'll get into that a little later if the member would like, on partnering with some of the business organizations and so on to incent adaptation and so on, are really going to be helping as we move forward our small business community to do an even better job. And so sometimes it takes things like this to shake up organizations and to move them forward. And this virtual care of folks, not exclusively seniors by any stretch, but people who are moved out of ICU, means that you can, with more confidence as a patient or as a family member, know that that person is not going to be forgotten in the mix, that they'll be able to get that outpatient care after they move out of the ICU back into their home. And if this is somebody who's in a small community, that traditionally wasn't anything that was available to them. Yesterday's announcement about the expansion of broadband into, over the next 3 or 4 years, we think, beginning as early as this fall, into hundreds of communities. And I can share more of the details on that too. If I can get the detailed sheet on that, it'd be great. Is really exciting, in particular for Indigenous communities, for rural communities, where we have been not well served. And I think I could get the actual data from the CRTC website. That would really help, just to illustrate how important this issue is. But that broadband expansion will mean that things like this are available much more widely. And in Manitoba, we have been the worst served for a long time on access to internet. And this has been an ongoing thorn in the side of Manitobans. Frankly, I would say hundreds of thousands of Manitobans, not just those who live in these communities, but those who have friends who live in these communities, family who live in these communities, who are really understanding that this is a limiting factor in our time. So I look forward to sharing with the members interested in sharing some of the detail on that expansion of broadband. It's, I think, for members in his caucus, like the member for Flin Flon or the member for the PAW, they're going to be really pleased to hear about this, the member for Quadnick too. But it's not exclusively northern communities, it's rural as well. Thanks, Mr. Chair.
The Leader of the Official Opposition.
Yeah, no, I would like to discuss that perhaps a little bit later, as well as more on the vaccination program. But I do just kind of want to put a finer point on the ICU situation and have the Premier walk us through those numbers. Can the Premier tell us what the ICU numbers in terms of beds are at? And, you know, where are we expected to have to go in the next 2 weeks in terms of available beds across Manitoba?
The Honorable First Minister.
Right, I look forward to providing that information to the minister, or to the member opposite as soon as I receive it. I'll go back to the earlier question about vaccine numbers. I mentioned the total doses. I should also expand on that a little bit. The First Nations doses administered are being manually added, both first and second doses. So that is in partnership with our First Nations Vax team. Repeat, over 500,000 first doses. Total so is 625,000 plus, 536,000 first, about 80,000 second. So far, presently I should say, we have about 35,500 doses that are allocated to First Nations partners. We have 7,600 doses allocated to medical clinics and pharmacies. We have over 95,000 doses allocated to super sites, FIT, which is the what's called fast immunization teams, and pop-up clinics. Without new supply, the doses for the super sites, the FIT teams, the pop-up clinics will run out in about 9 days. Now, this gets back to this issue of supply, which is not as bad as it's been, but has been bad. We were, as a country, we were dependent on, made dependent on other suppliers. And so we languished at about 55th, 65th in ranking on getting vaccines out because we weren't getting vaccines here into Canada. The federal government took some criticism for that, but they've upped their game in recent weeks, and we hope that continues. So Manitoba has confirmed vaccine allocation of Pfizer until the week of June 28th. The week of May 17 to 24, Manitoba expects to receive 73,700 doses a week. The week of May 31 to weeks of May 21 to June 28, that 5-week period, we expect to receive 87,750 doses a week. And our team, I can probably also go over the list of all the sites, if I can get that. The list of all the clinics and sites is somewhere here. But our team has worked so hard to build up all these various outlets to accommodate getting the vaccine out. And again, I say thanks to them. We're very confident that we can continue this flow rate. There's been some real confusion on the part, in particular, of one columnist at the Free Press as to why vaccines are in fridges. I remember there was a time when the opposition leader was asking questions about why so many vaccines in fridges. A briefing, and I would hope that that question would have been addressed by the briefing that I offered him. I expect it was, and he would now understand better inventory management than apparently the columnist does in his photocopied columns. But I can only say that having vaccines in fridges is essential. If they're not in the fridge, they're not used, they're going to deteriorate, and you'll have vaccine wastage. They need to be in the fridges. Up until recently, if we had injected all those vaccines in 3 days, we'd have been out for the following 5, which means that we wouldn't have been able to continue with our staffing and keep our people at work. We would have had people working and then not working, and they would have perhaps left our work sites. In addition, if we had tried to force all the vaccines out fast, we wouldn't have been able to make them available in a variety of ways. Not everybody wants to go to the super site, apparently. As much as I think the member opposite and I and our families would rush to the super site, not everybody feels the same way. Some people are reluctant. They only want somebody putting a needle in their arm who they know. And so they want to get their vaccine from their regular person they know. And for that reason, we made vaccines available through the physicians, because for the comfort level of some Manitobans, that was the way to get those vaccines to be taken up. You know, there was some criticism that that took longer, but it also works better for some people. Not, you know, it's not a one-size-fits-all situation. So I'll just, and I hope to have
The Honorable First Minister's time has expired. The Leader of the Official Opposition.
There's a quote that's often attributed in some of the circles that I walk in to Gary Dewar, but I think it's actually from Mark Twain, and it says, "Don't pick a fight with people who buy their ink by the barrel." So that was some advice shared with me in the past about duking it out with certain commentators and stuff like that. So I'll just leave that on the record. But I am very curious in this whole conversation about vaccination. I think this is our shared interest. We all want to see this thing succeed. We want to see everyone in Manitoba get that shot. We want to see our way of life return to normal later this year, hopefully. Hopefully everything goes well. I did want to pick up on a point the Premier was just talking about, because I think it's an important one. Accessibility. Making the vaccination program accessible to Manitobans. And so, you know, on that point, I think there's a few things. There's the one the Premier just mentioned, which is people's level of comfort. They may know their pharmacist in their neighborhood. They may have a family doc. It's my understanding that there may be the potential to have other vaccines made available in some of those settings. I believe right now it's just AstraZeneca that's available in some of those, but is there a chance we could be looking at Pfizer, or could we be looking at Moderna? Some of the other vaccines, the mRNA vaccines. What's being done to make those available in other settings, like doctors' offices, like pharmacies? You know, I think there's a good point made here by the Premier, and I think Manitobans, other members of the committee would want to know. How are we proceeding with that? How are we making that more available to people in those settings?
The Honorable First Minister.
Yeah, I'm appreciative of the member's Mark Twain quote very much. Of course, when there are repeated errors, one has to confront that, and a professional journalist would want you to. An unprofessional journalist might not. But for example, when it was reported today, I think in the Free Press, that the member had answered the question about not paying his taxes by releasing his tax returns. That was an error, because he didn't. He released 1 year of tax returns, so a plural shouldn't be used in the answer. And a 1 year tax return doesn't answer the question that was raised either. So I think it's fair to ask for accuracy. I don't think it's unfair. And I don't think it should be miscategorized, but it might be by an overly defensive columnist. Columnists, of course, don't have to have the facts. They just sit down at a keyboard and they get to write. On the facts, though, that the member had asked for, I just wanted to answer his question about capacity. I think we've got it now on the ICU beds. So base capacity at HSC was, I don't know the date on this, but was 39. I don't know how long ago that was. Currently with 52 ICU beds there. And the goal, so it kind of, there's three parts to this. There's the base bed number, there's the current number, there's the number they're working towards. So they're in the direction. So just to clarify these numbers. So the base number at HSC, which is of course the biggest ICU facility we have, was 39, now 52, shooting for 58 there. On St. B, 14, 24, up to 24 now currently, big increase there, 4 more to come. So 28's their aspirational number, I'll call it. I can't share with the member the time frames on these. I don't have that data, but we could endeavor to get that if he would like that. I think we could get that from Ms. Siragusa or from the medical team. as to the time when they aspire to have these extra beds added. I think that would probably be a logical question we should answer for you. On Grace, base was 10, 12 currently. They're going to be adding 4 more there, so 16. And Brandon, 9, adding 4, 13. As of midnight yesterday, there were 118 patients in ICUs. There were the normal baseline capacity is 72, as the member can, as I've just shared with the member. We have additional capacity, but this is a major concern, I know, for all of us, that this capacity was expanded previously and it continues to expand is essential, and I thank everyone involved throughout the system. And I'll single out Ms. Siragusa for her leadership and respect of the coordination work that she has done throughout this pandemic, and our professional staff too. There were, and giving the member the update as of yesterday, there were 62, I don't have today's in front of me, but yeah, this is yesterday's stuff, it's okay. There were 62 patients who either have active COVID cases or who are no longer infectious, but are still very sick and in need of intensive inpatient care. It should be noted, and this is the thing with the variants, the member knows that these variants seem to be more pernicious with younger people. I got a sense from his relief earlier and his reference to his boys that this is a particularly important concern for a lot of families, because they understand these variants can affect younger people. 12 of the 62 patients are under the age of 40. And I'll finish up. I see my time is up, Mr. Chair, but I'll just finish with the numbers the member had asked for here in a minute.
The Leader of the Official Opposition.
Yeah, I think that's an important point to have on the record. So yeah, I would ask the Premier to continue with that line of explanation. And I'd also just ask the Premier just to clarify for me, you know, he said currently 52, 24, 12, 13 beds at the 4 ICU sites, that's 101. He said there were 118 ICU patients as of midnight last night. So was it 62? No, sorry, I'm just talking about the overall capacity. Yeah, the capacity number, I think totals 101, but the number of patients in ICU is 118. So can the Premier explain like how we're caring for the additional patients? Like what's the situation going on there with those folks? So I just did the numbers on the ICU beds that were shared, and I get 101, and then I get 118 ICU patients as of last night. So I just wondered, like, how are the additional folks being cared for? Like, is that, you know, they're being used in temporary spaces with extender staff, or are those numbers right? 118 ICU patients as of last night, 52 beds at HSC, 24 at St. B, 12 at Grace, 13 at Brandon. We make that work, you know, I'm trying to understand what's the situation there. And then again, to pick up on the Premier's, I guess he was continuing to explain the ICU situation there. I'd like to hear that answer as well.
Sure.
The Honourable First Minister.
So I'll do my best to get an answer to that question. I'll continue to relay what information I have to the member, as has been my custom through these processes. So I mentioned the number of patients that were under 40. The age band has changed significantly. I don't have a historic one to show the member, but early days it was plus 70, plus 80, plus 90. Now with the vaccine program, which at some point I'm going to get the information on what percentage of by age has been vaccinated, but it's significantly high for the older folks, which is great, because that was those were your most vulnerable in terms of possibly dying as a consequence. The interesting challenge that every province is facing now with more younger people is they start stronger and they hang on longer, and so the ICU trail on the graph, I'm told, can extend for a long period of time, even after infection, right? Because younger folks are hanging in there. And so that's an issue as well, and this is going to be an ongoing challenge, I think, for our healthcare leadership as we move forward. On the age band, I'll just share with the committee members, and I'll just give you the total number of cases. I won't get into some of the post or during categories, just to say between 70 and 79, we have 62 ICU active or post-infectious cases of COVID right now. 62. In 70 to 79 bracket, it's 8. 60 to 69, 13. 50 to 59, 14. 40 to 49, 15. 30 to 39, 5. 20 to 29, 4. 10 to 19, 3. So that has shifted significantly downward, not solely as a consequence of variants, though variants of concern are an impact clearly, but also doubly so because of the number of vaccinations that we've had. We started not exclusively by age, we started with vulnerability, we expanded down gradually by age, plus the vax team went to these so-called hot zones, went to target those. Indigenous folks in the north were given the vaccine at younger ages. We started about 20 years younger, if I recall, and then actually went to some of the harder hit communities and blitzed in there basically to get those folks vaccinated. Made a lot of sense, and I know Manitobans support that, and thanks to our team on that. 71 patients were on ventilators. This is yesterday. Don't have today's numbers in front of me. Including 43 patients who have or had COVID. So of the 71 on ventilators, 43. We have really increased our ventilator capacity throughout the system, and that's good news. 7 of those 43 are under the age of 40. And of course, the number of patients in ICUs changes, as I've just illustrated here, where the number went down significantly today, but it may bounce back up. I'm not trying to tell the member it's great news and a trend. It goes back and forth. These current numbers are below the peak of the second wave. We're all hopeful that that's where they stay and they begin to drop, as I said, as a consequence in part of restrictions. At a larger causative factor is Manitoba's willingness to follow those restrictions. I'll share some of the enforcement data here. Sad reality of this pandemic is that we've had to we've tried very hard to educate as the primary way to get the word out to people, but for some people it doesn't seem they listen to education. They need a threat of a fine, sadly. In total, there were 240 patients hospitalized due to COVID. This is yesterday morning, I repeat, including those in ICU. 183 active cases, 57 post-infectious cases, 54 patients in total under the age of 40, 8 under the age of 20. And I see my time's up. I just got a little bit more info here that I think the member will want to know about why patient counts are going to take time. As I talked about that trail on the graph, there's a reality that we need to understand here.
The Leader of the Official Opposition.
Yeah, it's a trailing indicator. It's a lagging indicator. I think we all do expect, just given 560 cases yesterday and in the 300s for the 2 days before, 500s for a few days before that, that there will be increasing hospitalization and ICU numbers over the weeks to come. How much does that impact the overall number as other people leave ICU, other people leave hospital? Remains to be seen. Hopefully we get some answers on some of those questions when it comes to the modeling piece. I did just want to put on the record, it's very sad to hear about the 10 to 19 age group having 3 people in ICU, and of course, it's very sad when anyone's fighting for their life in an ICU. We're talking about kids, you know, it's definitely, it's pretty heavy to think about that. So definitely all my best to the families and those fighting. We wish them the best and a speedy recovery for sure. I'd like to talk about the vaccination program again. I did pose that question about access. I think it's a pilot program going on with Moderna in pharmacies. You know, I think CBC, maybe CTV had an article about some of that work happening. I just wanted to ask, I guess, where is that in terms of piloting? I assume the idea is you test it with those high volume pharmacies, you expand it beyond that, and maybe it's more generally available in pharmacies. So I guess two questions. Can we have an update for the committee? Where does that stand, and when do we expect like maybe a broader rollout of Moderna and other vaccines in pharmacies? And then I guess the second point is just to like flesh out, what does that look like? Is it going to be just like, you know, the big shoppers in Rexall who can handle a high volume who are gonna see that? Or would this also then, it's going to go to the more like independent, local neighborhood pharmacies as well? So Premier, talk about that pilot and what it's going to look like once it's past the pilot stage.
The Honourable First Minister.
Yeah, I'm glad to, and I'll just go back to the question was asked earlier. Key stats here now. These may be a day out of date, but they'll be pretty close. 90.9% of Manitobans 80 plus. And I know the member and I are both equally enthusiastic about encouraging vaccines to be taken up. There's still 9% approximately of Manitobans over 80 who have not yet got a vaccine. 87.7% of Manitobans between 70 and 79 have at least one dose. We're referring only to one dose totals now. Morning. And 52.7% of Manitobans aged 50 to 59 have at least one dose, which is pretty incredible because it's only a couple, 2.5 weeks ago that group actually became eligible for vaccines. So that's an incredible thing to have happen in less than 3 weeks. Among all seniors in Manitoba, 65 plus, use that definition, a group that has been eligible for weeks, 86.5% have received their first dose. And I wanted to say, because a member for St. John is here, thank you to her for promoting vaccine awareness. I liked her statement the other day very much. I thought it was great. This is a real key. I've got, I think, some exciting information can I share? It's sort of formative, but a little later on about vaccine encouragement. It's just in the planning stages, but I think we should, this is not partisan. This is not partisan. We got to get people vaccinated. Come on. So I'm excited to share some more information with the members on this because, boy, we got to push on this. We got so many people that are so hesitant. I've got friends who are. You've got friends who are. It's a challenge, boy, and we've got to face it together. And the more we can do, we have that profile piece. I know a member for St. John's is part of that, promoting in the city in particular uptake. We've got to go for it. We've really got to go for it. Save lives, and it'll get us our lives back faster. You know, really important. Men, we're finding, are lagging. Now, I know the member for St. John's is going to say this is true in every category, but I don't necessarily agree. Men are lagging women in respect of getting vaccines by a full 5%. So we've got to know who we're trying to market to, too. We've got to be very conscious of who it is we're trying to persuade, because not everybody thinks the way we do under this dome. You know, we've got to market this thing. I'll just continue with answering the member's question, but I referenced 576,000 as of, this is as of 4 days ago, I'm sorry, on this one, have been vaccinated. In addition, on the question he raised about access points and so on, obviously this has put a strain on every province's budget, and this is 1.2 billion is the COVID funding in this year's budget alone, which is an amazing thing to say in a sentence. that the amount of money that has been invested by governments, federal too, I mean, in particular the federal government, should be, I think, complimented for focusing its resources. Not always effectively, no, but because we're making this up as we go along. We haven't got precedents. And there's been a lot of criticism directed at the federal government for its wage subsidy program. I'm reading in the Globe and Mail reports in the last few days about money going to very, very, very fortunate and profitable companies in wage subsidies that just makes you wonder if we could have had that money for health transfers instead. It would have really helped, you know. So there's room for error, I suppose, and there's room for criticism. And in the post-pandemic analysis period, I'm sure a lot of that will be done. I would encourage members to stick to the focused issues at hand, which are getting people to get vaccinated and following those public health rules. That's how we get through this. Anyway, as you know, we've expanded the vaccine eligibility, as the member in his intro comments addressed. This week, 14 pop-up clinics. These are really helpful because they allow Manitobans. Some Manitobans don't have difficulty with mobility. Some Manitobans have difficulty with transportation access. Pop-up clinics around the province are really helping. We introduced the paid sick leave program. It's direct financial assistance to Manitobans that have to take time off from work. And I'll get into the other items here in a second.
The Leader of the Official Opposition.
Thanks again, Mr. Chair. So, yeah, I just want to return to the question of access or accessibility and access, I guess, but just accessibility when it comes to the vaccine. You know, the vaccination program is moving towards, you know, just being heavily focused on Pfizer and Moderna. The Premier acknowledged earlier that there's, you know, they're a little bit more high maintenance, I guess we could say, when it comes to those two. What's going to happen with second doses when we're talking about northern Manitoba? Are they going to be, you know, including more Pfizer in that rollout? And what about travel? If you know, people need to travel, is the government going to help with that? Is there going to be assistance with helping people get to super sites? The 211 number was announced. However, some folks are still finding a barrier when it comes to getting transportation to a vaccine site. So, you know, what can the Premier tell us about steps taken to help those folks?
The Honourable First Minister.
Mr. Chair, thank you. I can share a bit of information on that. We can, I think, get even more. I'll start with the AstraZeneca because it's been much in the news lately. We've confirmed vaccine allocations of that AstraZeneca, much discussed AstraZeneca and much concerned about AstraZeneca vaccine out there. I think we have over 70,000 Manitobans that have the AZ for their first dose, and the VAX team, I think, is planning to release even more information next week on its plans for its strategies for second dose. There's a lot of discussion right now about this mix and match research that's out there. Can you not take the AZ if you have a concern on your second dose, right? And this is so we're following the research. There is imminent research to come out, we think, by the end of the month on this issue. Really important issue because, again, vaccine hesitancy is going to be fueled by concerns. Naturally, the media is reporting, as they must, on clots, right? And the numbers appear to be a higher percentage than was originally thought, so that creates a concern for people, and then a reluctance comes in. So the vaccine team decided, I think they announced this week, they're reserving the AZs for second dose for those who had first dose, because they're not sure yet if you would be as benefited by switching up. So we'll monitor that research. There's risks to everything. I mean, you know, some have been reported to some of my caucus. By doing that, they fueled the fear, you know, that maybe the AZ isn't safe. Well, you know, we need it for second doses. So frankly, we're not trying to fuel any fear here. We're trying to monitor the research and do the right thing. We all know that a person who takes the AZ, regardless of the most recent stats or earlier stats, is far better off to have it, especially over 40, right? We know those numbers, especially over 40, than if they don't take a vaccine. They're way more likely to contract COVID, obviously, but you know, the concerns are still there because of the media reports, and that's the nature of the beast. Then when NACI comes out and says, well, I wouldn't give it to my sister, then you got a problem. Then you got a problem. And then the Prime Minister has to go out and say, take the first one. I think, didn't he take AZ? Yeah. So, you know, that's where we're at on that one. Kind of a Rocky Horror Picture Show. I don't know how to describe it. It's not, it's been, the comms around that one haven't been great. Janssen, federal government, this is last week, 10,900 doses of Janssen. But Health Canada is holding that back due to some possible quality control issues, and they won't release the product. So, good. That's what they should be doing. The access points the member had asked about. Let's get into that one. I think I have here some information the member would want. I mentioned the paid sick leave program, which, you know, and I elaborated a little bit yesterday on why I think several of the premiers, in particular Premier Horgan and I, were not super impressed with the federal response, but I'll leave it there. 7 vaccination super sites up and running, 2 in Winnipeg, but we also have sites around the province: Morden, Brandon, Selkirk, Thompson, Dauphin. In terms, and a thank you to the folks that are working at those super sites. We have over 3,000 staff that are helping to vaccinate literally thousands of Manitobans every day of the week now. So what was our number yesterday, David, on no, on vaccinations? Wasn't it 15,000, 14,700? Yeah, anyway, well, as well, as I mentioned before, we prioritize those who are most at risk. So we began with our healthcare employees, our Indigenous people, PCH residents, police officers, first responders were included in that prioritization list as well early on. And you're telling me I'm out of time. Yeah.
The Leader of the Official Opposition.
Yeah, just while we're talking about the vaccination campaign, I'd like to ask about the Providence deal as well. So with the deposit, like, has the government of Manitoba paid that $7.2 million to Providence?
The Honourable First Minister.
Yeah, I'd be happy to address. I'll just get the information for the member, and I'll just continue to say the Moderna doses, I'm told, on the pilot that he asked about earlier, just got that info for him. 2,300 Moderna doses sent to 6 medical clinics and 5 pharmacies. 8 of these locations are in Winnipeg. 1's in Brandon, 1 in Dauphin, 1 in Neepawa, and it varies, right? Between 100 and 500 doses at for each location, spread out across the province on the pilot. Okay? Yeah, and that's underway right now. Yeah, so that's underway as we speak. Just worth going back a little bit, I think, and saying that what the VAX team did, and again, I'm appreciative. I know that they're open to criticism, as anyone is in this pandemic, for making decisions, but you know, they made them. Not all of them are going to work out. You know, there's probably the best hitter, and some would argue, in the history of baseball would be Teddy Williams, and he went out more than 6 times out of 10 he went to the plate. So there's failure everywhere. The failure would be in not attempting. And so here we have a vaccine team that's attempted, and I think they should be acknowledged for their efforts, respect what they're doing. We appreciate and thank them for what they're doing. So they expanded, they made the decision to expand into geographic areas of concern. What this meant was that they potentially got criticized for not moving fast enough down the ages, right? Because the vaccines can't be in two places at the same time. If you move them into those hot zones, you're taking them away from people who are 53 when the age is 55. They won't get them as fast because those vaccines aren't as available as fast to move the age down. You get the logic of this. They got some criticism for doing that from some who were anxious and understandably anxious, wanting to get their vaccines. But they expanded into Winnipeg, into these geographic areas of concern, because that was where they were seeing some of the close contacts resulting, for example, in more cases, and where their contact tracing was showing them that they needed to preempt the potential expansion of an already expanding number of cases. So in Winnipeg, that included River East South, St. Vital North, Seven Oaks East, Inkster West, Fort Garry South, Point Douglas North, Downtown West, Downtown East, Inkster East, Point Douglas South, Seven Oaks West. By going into those areas, they may well have helped us to address some of the what we're seeing now with the increase in numbers could well have been worse. I expect they're going to, when they release their modeling, these will be some of the questions the media will most certainly be asking. How's that hot zone thing working out for you? And we think that the preemptive work that the vaccine team did and those difficult decisions was part of that. I would also say in the Interlake, Powerview and Pine Falls were targeted. And what does this mean? Eligibility dropped, depended on the specific area and time, but age dropped mostly so that younger people could get the vaccine, in many cases 18 up. In Brandon East End, and then Brandon downtown. And then we expanded, of course, to all those living or working in the northern region as well. I mentioned doctors' offices and pharmacies, again, partnering with them. And this is to assist in making sure that folks are comfortable and can access in a manner that's convenient to them their vaccines. I'll also expand on an answer to the member's question in respect to the Indigenous-led activities, but I see I'm out of time again.
The Leader of the Official Opposition.
I just wanted to ask on Providence, the $7.2 million deposit, has the government of Manitoba paid that to Providence already?
The Honorable First Minister.
Yeah, I'll certainly endeavor to get that. First, before I get into the detail on that, I'll just assure the member that no money's changing hands here yet. Okay, so that contract is not finalized and no money's changing hands. So that's where that sits right now. It was a really interesting, I mean, we're all hopeful, right? We're all hopeful that we can get domestic vaccines. I'll just say that before I get the detail. And clearly that would be better than counting on another country where they have a pandemic and are not supplying us. This is the situation we've been put in by the, for whatever reason. We'll leave it there. Manitoba took the lead in this effort. We've got other provinces now, we know, across the country looking also to support domestic production. Clearly, this is going to be an issue going forward, and we didn't present the Providence thing as a panacea. It's not. But it would be better if we could have access to vaccines here in Manitoba and across Canada. Not in this alone, of course. We've got partners and friends all across the country and around the world. But here in Manitoba, to expect that we're going to be anything but advantaged by having more domestic production. This is our largest sector of our economy, is drug manufacturing, right? We have the ability to manufacture drugs here. And we need to be able to do that, to produce those kinds of vaccines that we need now, but we would have had to have started that years ago. So we're starting now so that hopefully come the future when we need booster shots, for example, we'll be able to access them from a made in Manitoba provider. Certainly if we can do that, as my old grandmother used to say, surest way to help the needy, my boy. Don't be one yourself. So if Manitoba can supply our vaccine needs here, then the federal government, we don't need to depend on a federal government, and we can quite possibly supply our neighboring provinces with vaccines as well. That would be the hope. So I'm just waiting for the detail that the member's asking for. I'll share that with him as soon as I get it. I'll just go further and say I don't think enough praise can be given to our Indigenous partners through this whole process. We have really worked hard. I emphasized this at the outset of the pandemic. I wanted to make sure that our Indigenous, not just our Indigenous leadership, our Indigenous communities were involved in this process as much as we could. The immunization, First Nations Indigenous team has worked very closely throughout this pandemic within the structure that we've created and done an amazing job. And I thank them. And I thank our First Nations leadership in the communities as well as the Grand Chiefs for their efforts, diligent efforts for the most part, diligent efforts to stay focused on the distancing and the fundamentals. I grew up next to Long Plain First Nation as an example, and just in visiting there early in the pandemic, they had put checkpoints up, roadblocks to make sure that visitors were checked before they came into the community. They had really taken good precautions, and congratulations to Chief and Council there for taking that initiative on. And as a consequence, had done very well in reducing the number of cases in their community, as many communities have. Unfortunately, despite the best efforts of many First Nations leaders, there were severe outbreaks, as we well know, well reported. I won't start naming communities, but COVID is sneaky, and it can get into a community despite the best efforts of community leadership. But I don't doubt the efforts were sincere and very consistent across First Nations communities. So 5 urban Indigenous community organizations created Indigenous-led immunization clinics. 3 of those are open in Winnipeg, in Brandon, in Portage right now, to help vaccinate at-risk urban populations as well as homeless populations, and that's important as well. See, my time is up, so I'll just I can finish this up in a minute.
The Leader of the Official Opposition.
Thanks again, Mr. Chair. So I just want to pick up on the Providence piece. You know, the Premier says no money's changed hands, but he also talks about pursuing this. So I'd just like clarity. So is it fair to say the deal with Providence is still being developed? How does the Premier characterize that? Is it like the door is still open to the deal? Has the Premier walked away from it? Or is it, like, what's the current status of this? Is it in negotiation? Is it just buy for now? Or is it somewhere in between?
The Honourable First Minister.
I'll just say we've got a few irons in the fire to enhance domestic availability of vaccines and to produce domestic vaccines here in hopefully Manitoba, or in partnership with some other provinces. I'll be able to share some of that, I think, in the next 2 weeks as we finalize, we hope, some of those irons. So, you know, it's good news, you know, to be able to have those vaccines available here, not to be waiting, not to be worrying that we're going to run out of vaccines in 3 days, you know, when we're in the midst of that vulnerable period, not to be sitting at, you know, whatever, 63rd in the world. You know, we all hope and pray this never happens again, but we're going to need booster shots. That's an obvious need. If we can, this is you know, it's been an amazing exercise in Fed-Prov dynamic, because of course the provinces have always been responsible for delivering health care. The feds have been partners in funding. The feds reduced their share over time, as we know, and as we know has to change. But at the same time, the feds came in and said, we'll look after your vaccine procurement, just like they said, we'll look after your PPE. Well, that didn't work too well. It's not something they've been doing before in their defense. Brand new. On the PPE, not so good. So in Manitoba, much credit to our Minister of Central Services and his deputy and his team. they went out and they said, let's actively work with our small business community in Manitoba to see what we can produce here. And I can share with you some of the detail. I know the members are familiar with some of the community work that was done, some of the production that was accelerated. Thanks to our small business people for being so supportive and so adaptable. Some companies actually changed from, you know, beer to hand sanitizer, whatever the case may be. And that was tremendous. And to see that work done was great. But on the issue of vaccines, we were counting on the feds to provide those. They are now stepping up, but a lot later than just 50 miles south of here, let's face it. So we have other countries, Israel, I could give you the list, but the members know this, that are so far ahead of us on vaccination schedule. And so to them, it's already unmasking time. It's get your life back time because they got their vaccine issues dealt with early. Here, we're getting better, but we're at the mercy, pretty much, of the federal procurement minister. I don't like that, and I know that as we move forward, healthcare will remain constitutionally a provincial area of responsibility. So for that reason, I'm excited to share more detail with the member when I get it on some of the initiatives we're taking to make sure we're doing our part here in Manitoba to make sure we're not needing and not dependent on the federal government to do a job that, since the advent of Canada Health Act, was a provincial responsibility. It's our responsibility to innovate, our responsibility to procure, our responsibility to coordinate with other provinces in a cooperative way. That's exactly what we've been pursuing. So because there's no definitive answer I can give the member at this point, I'll simply say nothing is off the table. Many things are on the table. I hope to be able to share with my colleagues more progress in the not too distant future on this front. On the First Nations partnership, again, I just wanted to say our leads there have developed a structure for integrating our FIT teams, and that's really been a useful vehicle for getting out to communities. This is those fast immunization squads, and they have really helped us to get our model working better. It's fine to talk in theory, but it's the actual implementation of those FIT teams that is really getting results. So we've prioritized that model for on-reserve, not just on-reserve communities, I should mention adjacent Northern Affairs communities as well. Our minister there has played a key role in respect of this coordination and this relationship building, and now we're building even stronger relationships with the Northern Affairs communities and First Nations communities on this. The completion, non-adjacent, I should mention this is good news, the non-adjacent Northern Affairs communities and the municipalities that are identified in the oh, you're going to cut me off, aren't you? Okay, I'll finish that in a sec because I think members will be interested in knowing this is this important news.
The Leader of the Official Opposition.
So on the Providence thing again, well, maybe not Providence directly, but when the Premier says there's a few irons in the fire, so that means the Premier is pursuing supply from other companies or pursuing deals with other companies that have vaccines in development?
The Honorable First Minister.
Thank you very much, Mr. Chair. As I said to the member, I'm looking forward to sharing the updates with him, but because of the nature of where these negotiations are at right now, I prefer not to give too much more information out than that. But I would just say to him, we're, I think, very hopeful that we'll have some positive news to announce in the not too distant future. But I wanted to just continue with the First Nations update because it's a very important part of our overall response. The non-adjacent Northern Affairs communities and municipalities that have been identified in the prioritization list for FIT teams to get out to will be addressed with a partnership that involves the ops team, our operations team, working with the RHAs, and the planned completion of second doses. I want to emphasize this is our second dose going out now to those communities is May the 20th. So that's pretty exciting. I know for the folks in those communities, they are really, really excited about that. On the urban side, on the urban Indigenous clinics, those sites have been confirmed already. Mamawitak in Thompson was operational back on May the 4th. Brandon Friendship Center on College Avenue in Brandon was operational on the 27th of April. My old hometown of Portage la Prairie has Prairie Fusion Arts and Entertainment Center, operational as of a week and a half ago, May 4th. Aboriginal Health and Wellness Center on Higgins, as I think members may be aware, was operational on April 29th. And Mamawee, Wingardner Place and McGregor, operational as of April 29th. Should mention also that there's been some mRNA vaccine has also been allocated to a pharmacy specifically addressing the Métis population as part of the ongoing conversations with Métis leadership. I should also mention, share with members that I have noted that there was a deal signed between Ottawa and David Chartrand over at the MMF. There have been many deals signed, as is appropriate given the Daniels court case. I think the federal government has moved in to support the Métis people in a more, shall we say, fulsome manner. And did announce hundreds of millions of dollars of additional funding just prior to the last federal election, some of which has flowed and other of which is planned to flow. And that was all public, and that's as it should be. But last week, a deal was announced, which noted it was in reference to Capion, which was surprising because it was the Treaty 1 chiefs who did the legwork and the lion's share of the work on the Capion project. I was in Ottawa through those number of years when people like Chief Dennis Meachies and Chief Hudson at Peguis were diligently pursuing through land agreements. They were diligently pursuing the idea of taking over the Capion property. David Chartrand wasn't involved in that until all the work had been done at the tail end. In any case, the federal government announced to much ballyhoo that they had signed a deal with the MMF regarding the Capion situation that essentially, I gather, was so that the MMF would drop their lawsuit. And I'm left to interpret why they would sign this deal because of the fact that it was secret. And this I raise because I don't think that's in the best interest. That certainly goes contrary to the TRC recommendations themselves. It doesn't help with the reconciliation efforts in a broader sense. And I don't think it's entirely respectful either to the First Nations partners that have led this proposed project for so long. So I'll share with the members, asked the Prime Minister to share with us the details of this so they can be public, so we know. And I think that's what the Métis people of Manitoba deserve. I think that's what the First Nations people of Manitoba deserve. I don't think these deals should be done the old way, signed behind closed doors and left to be secret. And so that's how the federal government did all their other deals, was public. That's the way it should be. You can like it or not, but they were public about it. This one being secret, I think it's raised the concerns of a number of people in the Métis community itself as to why
First Minister's time has expired. The Leader of the Official Opposition.
Thanks for that, Mr. Chair. So again, just on the topic of the ICUs, just want to circle back on that. After the H1N1 pandemic, there was an assessment of ICU capacity and hospital capacity carried out in Manitoba, and it led to increased number of beds. So I wanted to ask if the Premier coming out of this pandemic would commit to not just a temporary increase in ICU capacity, but to assessing what the needs will be for Manitoba, because It's my understanding, even as we move out of the pandemic, COVID's not going to disappear. It's going to remain with us, hopefully at some lower level. And so we'll still have the flu season, normal demands on the ICU system, but now we'll have this new factor added to the mix, which seems on its face to suggest a need for increased ICU capacity on a go-forward basis rather than just on a temporary basis. So can the Premier commit that he'll carry out that assessment as we move towards hopefully the end of the pandemic?
The Honourable First Minister.
Yeah, we're on the same page entirely on this. The premiers have had discussion on this issue in particular. ICU capacity becomes a limiting factor, right? Limited ICU capacity, okay, so we have to bring in restrictions because we have to reduce the number of interactions is going to limit our recovery, our ability to recovery on an ongoing basis. So in 2009, some recommendations were made. I admit I haven't had a chance to review them recently, but I think what the member is saying resonates very much with our entire team. You know, this issue of ICU capacity is going to remain. It's going to remain a limiting factor. We've already taken steps during the pandemic to address, as I shared with the member earlier, a number of aspects of that in terms of training, facilitating movement, improving our ability to respond, and in terms of improving our ability also to have staff able to be mobile so they can go where there is a need, right? We have inherited a real challenge in respect of bargaining units. I won't get into too much of the weeds, I hope, but we have more bargaining units and job description structures than anybody. I mean, it's just incredible. And they limit the ability of folks to go across a hall in some facilities to do work, even when their area is underutilized. If they were asked to go across to another area where there was a need, they wouldn't be able to go because of old structures, old bargaining structures and job description structures that we have already started to upgrade with the support and cooperation, actually, of the MNU and some, I'll just reference them as one of the major unions, but there are others as well. Because just this silo problem is very, very real. Gets in the way of workers being able to work, gets in the way of helping others, you know, really inhibiting our ability. As an example, I think we have close to 180 bargaining units within just the Winnipeg RHA, and there's fewer than that in all the other Western provinces combined, right? So what that does is it really inhibits your ability to manage. If the Leader of the Opposition and I were in charge of a health facility, a seniors home or whatever, it'd be great to have our people be able to move, you know, well, we need some help in this section, or we need some help with this task. We were really limited with that, but the MNU has been working with our senior health officials to change that, to expand the ability of our workers to work and to help. That's what people get into nursing, because that's what they get into nursing for, is to help. The inhibitions to that were very, very real. So that's being addressed. That'll help us going forward, I guess, is the long about way to get back to what the member asked, you know. The idea being to facilitate when we need the ICU, because the ICU needs are very unpredictable, but it is, I think, predictable that we're going to always be limited if we don't address ICU capacity going ahead further by the fact that we'll have to deprive people of certain freedoms or enter into certain restrictions to make sure that contacts are down and so on and so forth. So the fact that the member has mentioned is a very real fact. That's a limiting factor for us getting our lives back unless we address this issue. So we have in the interim, but I agree, this is an issue that needs to be assessed and is being assessed as we speak. But in terms of its longer term applications, for example, what if there's another variant that rears its head next year? We all hope not. We all hope not. But what if there isn't? We have to, that's what ICUs have to be ready to address, is the what if. And that's a hard thing to predict. But one thing that's easy to predict is if they're not there, if those IC units aren't there or they're limited, the restrictions, all these restrictions come back in. And we don't want that. Nobody wants that. So this is a really important issue that I appreciate the member raising. It's a really important issue. I just wanted to, oh, yeah, thank you. Just say also, on workforce issues within the VAX team, over 2,000 people have been hired by the task force, by the vaccine task force, to assist with the efforts. Immunizers, clinic managers, clinical leads, system navigators, observers as well. And that's in addition to over 1,000 staff that have been assigned from regional health authorities. So you're talking about over 3,000 people that are working to make this vaccine effort work. And I thank them and very much appreciate their efforts.
The Leader of the Official Opposition.
So definitely want to pick up that point on, you know, looking towards a time maybe when the restrictions are going away. But just to close the loop on that ICU point and reassessing what the need is going to be coming out of the pandemic, hopefully later this year, can the Premier just commit that the representatives of those healthcare workers will be engaged in that assessment and have input onto what that's going to look like? I'm thinking about the nurses union that the Premier mentioned, the Manitoba Allied Health Care Professionals, representatives like that. Can the Premier commit that they're going to have a say in that assessment process of the healthcare needs going forward?
The Honourable First Minister.
My understanding is that that process is underway now and that that consultative work is being done as we speak. And so this has definitely been a priority for us. It's become obvious and apparent through this pandemic that there needs to be a greater focus on this. You know, since 2009, the H1N1 situation, there wasn't a significant enhancement. We've proceeded with the recommendations of the Peachy Commission that were given to the previous government. To be fair, they were given to the previous government as a way to improve and expedite better care and better management, not just of ERs, but throughout the system. Weren't acted upon. It's always a challenge. Healthcare management, healthcare changes are hard for everybody. But consolidating our emergency facilities will be a part of enhancing that availability. But expanding ICU, as the members alluded to, is a key part as well. And so with the consolidation of our emergency facilities, we're the only jurisdiction, according to the Canadian Institute of Health Information, that has actually reduced our waits. Those waits have been stressed through this pandemic for, I think, fairly evident reasons. But at the same time, if we had not proceeded with those consolidations, those waits would have been a factor as well. They were a factor before. We had the longest waits in ERs before the pandemic, before we took the actions to the Peachy recommendations and began the implementation of construction of new facilities. For example, new ER at Grace, we're talking about over $40 million investment. Challenges there, the member is aware of recent challenges there as a consequence of the pandemic, but the reality is it would have been a worse situation, I would submit, had we not proceeded with the construction of that new facility. And so same at St. B, same at other facilities. We've injected a significant amount of capital and capital investment into our health institutions. I know perhaps later we'll talk about our educational institutions and the infrastructure investments we've committed to and made there. I'm excited, I guess, selfishly, because my riding is the only one of the 57 that doesn't have a high school. And I admit no conflict here. I just simply say it's about time that the Fort White area got a high school, and that is one of many schools that is in the planning stages or underway in terms of construction. I'm excited about that. I can share with the member later if he'd like more of the capital strategy and the human capital strategy as well in respect of our education investments. They're really significant, and they're going to be even more significant because this is the key, unlocking the potential of our young people, and so educational investments are key. If I have a bit of time, I was able to pull up the report from the Fiscal Studies Institute that the former Parliamentary Budget Officer, Head Officer Kevin Page, who somewhat might know because of his extensive work both in in Ottawa, being, I believe, the first parliamentary budget officer for a number of years, and now heading this fiscal institute. Yeah, well, it's a tough one. It's interesting. I remember being part of the finance committee when those recommendations came forward. It was actually Monty Solberg and I and Ronna Ambrose that came up with this idea. Oh, talk about a potential career-limiting move, you know? Well, it is interesting because, of course, it's an independent officer, and as the member knows, that can have benefits and drawbacks. Let's put it that way. But we felt that having that fiscal oversight was important. I still think it is, and I was proud to support the recommendation, and I was pleased when Prime Minister Harper adopted it, but I don't think he was always pleased after he adopted the recommendation. We'll leave it at that. My time's just about up, but I did have a short overview of the wait times issue that I talked about before. I think the member would find really interesting.
The Leader of the Official Opposition.
Thanks, Mr. Chair. So I recognize that the situation with COVID is it's very serious right now. We're seeing those high case counts. We have to do everything we can to fight the pandemic. We've got to keep Manitobans motivated in the fight against the pandemic and have that buy-in with the public health orders, have that buy-in with the vaccine campaign. I wonder whether you know, that light at the tunnel might help motivate people for doing their part to get the vaccines more quickly, to get them just as soon as they're able. So I'm curious about the reopening plan that was floated in some comments by the Premier. Dr. Rousseau may have also touched on it a bit in some media articles, but I think the Premier spoke on it publicly. We've seen Saskatchewan lay out a plan. We also saw some criticism of Saskatchewan's plan. Other jurisdictions have sort of sketched out reopening plans. Just curious, you know, when can we expect to see a plan like that for Manitoba, and what's it going to look like?
The Honourable First Minister.
Yeah, I really appreciate the member raising this. I think it's important. People need to see some hope as to where we're going, and they need to also feel that there's some reward. The vast majority of people are following the public health orders. There's some that aren't. That's a problem for sure, and that's the enforcement issue. I'll just quickly share with the member, but I've got the enforcement numbers here for last week, so I can share those in a sec, but I'll just say I really appreciate him raising this point, because I think having that hope out there is really important. I think most people certainly understand that we're coming later than everybody from Nova Scotia to the West Coast. We're coming into the third wave, and now we have the obligation to shorten it. How do you shorten it? Well, you get people vaccinated and you get them to follow those health orders. You do these two things, you can shorten it. We've done it before, and we can do it again. And Manitoba has the advantage of having a really good, strong community base, and community-minded people are involved in our plan, top to bottom. So this is how we beat this thing. But to get those extra people vaccinated that I keep harping on, you know, they have to see some benefit from this. They have to see that there's hope. And for others who are frustrated because they have lived with these restrictions, and I can give the history of the restrictions, but we've had some of the toughest restrictions in the country, as the member well knows. We've kept travel restrictions in place. We've kept gathering numbers down compared to other jurisdictions. And this has helped us hold off COVID for a time, but you aren't going to put your finger in the dike on this thing if you're, unless you're an island. I mean, it's different if it's New Zealand or some other place, but Manitoba, we're the crossroads of the country, and so COVID got here, and for whatever reason is spreading, and with these variants spreading fast. So we have to act. We acted in anticipation with some really strong enforcement. There was a study by the Canadian Civil Liberties Association, was just released yesterday, that Manitoba has the most active enforcement in Canada. They mentioned Quebec as well, so these two provinces. Quebec had far more cases than us earlier and bent the curve with enforcement and strong public health orders. We are far later to the situation, but we can bend the curve too with enforcement and strong public health orders. So our public health orders, and there will always be those who say there's too much, too many. We have protesters I expect coming today or again this weekend saying way too many restrictions. We have a court case across the road, way too many restrictions. And we have other people saying not enough restrictions, okay? Should have done it sooner, should have shut the whole economy down. A lot of those folks, of course, don't lose a paycheck when we shut the whole economy down. They're not workers in the hospitality industry. They're not working in a retail store. They're not trying to raise a family working 2 part-time jobs. They're people who have a paycheck. So they're strong advocates to shut the economy down. We have to find a balance, and Dr. Roussin has spoken about this many, many times. Finding that balance has been really, really difficult, and there's always room. I know the member had said, and I don't think he was harsh in saying it, he said he would have shut down 5 days earlier. That's what he said in the fall. Fair comment, fair comment. And, you know, in hindsight, if we had known all we know now, I think it's easy to support that thesis, you know. I do. I think if we know what we know now, looking back in time, 5 days earlier would have helped. I agree. I agree. Except we don't have time machines. We're living in an age where we're having to make it up as best we can every day. And we're doing the absolute best we can. So I'm not pleading for sympathy here. I'm simply saying that we're absolutely doing the best we can. So we introduced restrictions back. I'll just quickly go over those. Already, the strongest enforcement, as I noted, according to the Civil Liberties Association, and obviously their report didn't mean that as a compliment. I'll just put it mildly. Total tickets issued, largest in the country for our size. Fines, the most. We've just stiffened those, as I mentioned last Friday, announced that. The member would know that that's not a deterrent for him because he'll only get 2 warnings. You know, we doubled the fines, so he got a warning back a month or 2 months ago, and he'd get 2 warnings now. Big deal, right? But for the people that are actually flagrantly trying to disobey these rules, who've been fined, this we hope would act as a deterrent. And this is what we need. We need people to follow the public health orders, and we need people to get vaccinated. So yes, I anticipate within the next couple of weeks that a sort of a vision plan for some of what the members alluded to with respect to his reference to Saskatchewan will occur. But I would always add...
The Honourable First Minister's time has expired. The Leader of the Official Opposition.
So we'll look forward to the details on that when it is announced in the next couple of weeks. But what's it look like in broad strokes? What does the summer look like? Are we going to have you know, restaurants this summer? Are we going to have, I'm not thinking large gatherings, but are we going to have some outdoor gatherings this summer? What's the summer look like for Manitoba? And again, I'm not going to hold the Premier if you know, some unexpected thing, a variant happens that's unexpected at this point. But just in broad strokes, broad terms, we're looking ahead to a reopening plan being released in a couple of weeks. What could the summer look like in Manitoba if the vaccine program succeeds at the level we all want it to, and if we're successful in beating back this 3rd wave?
The Honourable First Minister.
Yeah. That's the real challenge with, you want to present a realistic, achievable possibility to people with the strong, and the members alluded to it, caveat, that it is in their hands. And unrealistic expectations are really dangerous. I remember the Prime Minister saying at Thanksgiving last year, if we do the right things at Thanksgiving, we can have our Christmas back. I think everybody... He has, yeah, and he's done it again this week, which to me is a federal pre-election siren song saying, 1 dose summer, you know, everybody gets their vaccine. And I don't mean that harshly. And he wants to give, I understand, he wants to give people hope, and he wants to inspire them to get a vaccine. I think that's where that comes from. But it's hard work. This pandemic is hard work. It's hard work for everybody. But if we don't do the work, we won't get our summer back. So we need to do our work. We need to follow the health orders. We need to get vaccinated. And so I believe that the plan that will be released and is in development as we speak, a lot of consultation going into it, will be designed to encourage those fundamentals as we have all the way along. We've been trying to encourage people to follow the fundamentals. And again, my thanks to Manitobans who have and continue to, because I know it's been hard. We've endeavored with our small business supports and all our programs, which I can go into detail on at another sitting if the member would like, to help people bridge through this situation. Just announced the fourth of the bridge grants. These are not going to heal all the injuries to small business across the province. Let's not kid ourselves. They're designed only to help small businesses to subsist to a degree and maintain some level of readiness so that they can get back to doing what they do best, creating jobs for all of us. Hopefully this summer, having the capacity to employ some of our young people, because that is a key danger with this COVID pandemic, is that it interrupts the ability, certainly for many people, to be able to generate some income and to generate the ability to support themselves and to pursue, if they wish, more education, post-secondary education. I think I feel this as an urgency in particular, I suppose, because I was there. If it wasn't for the generosity of people hiring this lanky, unskilled young person for a job, I don't know if I'd have been able to go to university. You know, my mother said I had to. You know, I think maybe the member can relate to that. We were told we were going, you know, but money wasn't there. So I think for many Manitobans, this is an emotional thing for me. But we have to do our best to get back so we can get our young people jobs so they can find their way. And the job itself, whether is an education, you know. I look back on my summer jobs and I'm so thankful I had the chance to learn from many of these jobs. It was great. It wasn't just the money you made, it was what you learned from having the job, right? That was important. So I don't want all our kids on CERB, and our kids don't want to be on CERB. A young man come up to me, cried in a grocery store a couple of weeks ago. I got my degree last year. I'm living on welfare. Every time I look in the mirror, I see a failure, he says. No, kid. No, you're not a failure. We got to get you a job, right? Because he didn't have enough income to qualify for CERB. He's living on EIA, you know? That's not what young people want. That's not what they deserve. So I say this because we've got to inspire, and we work together on this, we'll do better, you know? And we have been, I think, on many fronts, but we got to keep doing it. We got to get our lives back. We need everybody to get vaccinated, and we need everybody to follow those health orders.
The Leader of the Official Opposition.
Well, I say with, you know, little self-deprecation that when the Premier was talking about lanky, unskilled young person, my ears were burning, and I was going to raise a point of order, but then I realized he was talking about himself. But I want to talk about the reopening plan. Yes, our colleague, the Minister of Infrastructure, has never been criticized in that way or teased in that way. But I'm very curious about the reopening piece, and I would just note, like, the government of Canada put out like I'll call it a graphic or a tile similar to what Saskatchewan did. Obviously, it's conditional. It says if then. It's got like red, yellow, green stop sign approach, spring, summer, fall. Spring in the red situation pretty much describes the situation we're in now. Stay home, stay safe, get vaccinated, right? Looking ahead to summer, though, it's saying if 75% of those eligible for vaccines have one dose, 20% have a second dose, then maybe there's small outdoor gatherings with family and friends. It's conditional, I think is the point I'm getting across here. You hit certain vaccine thresholds across the population, and assuming the case counts and other indicators are moving in the right direction, you get other activities back. You get restrictions lifted. And then it looks ahead to the fall. Again, full availability of vaccines and uptake also. And then COVID's still here, but there's life returning to normal, if you will. So does that match in broad strokes what the province is looking at? Again, I'm not going to hold the Premier to a graphic that I just myself saw, 10 minutes ago, but is that what we're looking at? Tying a reopening towards, vaccination uptake, the health indicators, hospitalization, case counts moving in the right direction?
The Honorable First Minister.
Sorry, I apologize, Mr. Chair. Yeah, in broad strokes, I think so. I think that's a fair description. It continues, I think, to be our government's hope. I expect it's shared, that we can get our lives back, and we know what the preconditions are to that. I do think we know. But the question is, to what degree will the general public accept the work between now and that? And that is the vaccine and the public health orders, the combination of these things. I know there are other factors. There are other factors in terms of things that are not controllable by even the strongest person who follows those public health orders. Some people have got COVID. They did nothing wrong. Absolutely not. There's nothing that they did wrong. They followed the public health orders and they got COVID. It's not to say everyone who gets COVID is guilty of a sin of some kind. That's not what I'm saying. But I'm saying the public health orders reduce the likelihood of close contacts which lead to COVID. And so these measures, for example, we brought in Wave 3 orders back, the first set on April the 20th. Seems like eternity ago. But additional health restrictions, 2 designated visitors indoors. That was on April 20th. Some critics said, well, that wasn't harsh enough. Some said it was too harsh. That's the nature of the beast, eh? When you deal with these restrictions, it's always too much or too little. Depends on who you're talking to. Outdoor gatherings limited to 10. Faith-based gatherings 25% or 50. Weddings or funerals 10 people. My nephew's wedding is planned for July. There are people all over this province who have postponed their weddings. We haven't had my sister's funeral. It's a year. It's not fun. Sorry, not fun. And I'm just one guy. There's a million of us, and we're all making sacrifices here. But somebody has to get through to a certain group of people there. Health orders matter. Follow them. Because it is accelerating the rapidity of the transmission, that there is some ongoing disregard of those orders. I mean, we focused on education early. The member knows this. I mean, even he likes to tease about Ready, Safe, Grow, but SAFE was 2/3 of that campaign. And the education campaign that we pushed there was enormously important. And I think to a great degree worked. And I think the Engage MB exercise of involving Manitobans at every step of the way, dozens of health order announcements that I was part of. The members criticized me for not being at 3. I think I was at 38. Of those, many were bad news. Many of them were difficult things. I mean, restrictions like these are not easy things to announce, and especially to people who've done their best. So I am reinforcing what the member is saying. We need to put some hope in the window for those who are doing their best. These are people who want to see some hope, and I think it's critical that we do that. The members alluded to caveats, and obviously there have to be caveats in this because we don't know where the variants of concern are going to attack next. We don't know what the ICU situation is going to be. We do know that it will linger longer because of the younger demographic that is needing intensive care. And so as opposed to the, the old days of last fall, when there was a more rapid transition in ICUs, this is a more lingering effect on the graph. Eh? So, moving from April 20th on to just the following week, we strengthened those public health orders again. And I'll get into that in a second because I can see my time is up.
The Leader of the Official Opposition.
Thanks, Mr. Chair. So when we look at that, reopening with the caveats in place, we don't know the timing of it, right? It's going to depend on vaccine uptake and what's going on with transmission and hospitalizations, et cetera. But what comes back first, and then what comes back later on? Like, I'm guessing schools are first or very high on the list. It seems to have been the approach previously. Is that right? Or is there some other sector we're looking at reopening right away? Just what are we looking at potentially as a priority in terms of once we start to turn this thing around?
The Honorable First Minister.
Thanks, Mr. Chair. I don't want to preempt the work that's going on right now. There's a lot of people working on this plan, so I'm a little concerned that if I start venturing in here, I'll unduly influence the work of the group that is doing this. I don't mean to do that, so I respect the work that's being undertaken. But I will say that I expect in the next couple of weeks that information will be out there. And it's, I think, fair to say that we know a fair bit about what the priorities are of Manitobans in terms of what they would like to see, what they miss most, things like that from the Engage MB exercise, which we've done until the last two closure announcements, which we had to proceed, we thought, more rapidly, so we didn't involve Engage MB in those two. But in everyone prior to that, we had tens of thousands of Manitobans participate. And so we know through that exercise the things that Manitobans miss most. I don't need to list them off. The member misses them too. And so he knows that these are key things that need to be somewhere in that HOPE agenda because they are identified as priority issues. I mean, for many of us, it's just seeing family. And for others, it's being able to go for dinner. And for others, it's different things. But we know that those priorities are very real. That we need to put some hope in the window for them. But going back to April 28th, and I think this helps frame this discussion a bit. We introduced additional health orders for a 4-week period introduced on April 28th. No visitors, private households, with the exception of a person living alone. No indoor gatherings, outdoor gatherings up to 10 in public outdoor space only. Patio dining restricted to 4 people only with no household restriction. Food courts required to close in malls and shopping centers. Gyms and fitness centers continue with 25% capacity, always with physical distancing, of course. Spectators limited to 1 parent or caregiver per youth participant with physical distancing at outdoor sport and recreation facilities. Dance, theater, music schools, 25% capacity, but the maximum number of people on site to 10 with 1 parent or caregiver per youth, always with physical distancing. Brought those in on April 28th. Anecdotally, I believe, apart from Ontario at that point in time, those were the most severe restrictions in the country. Since then, I know that Alberta and Nova Scotia have moved to additional restrictions as their case counts have risen as well rapidly. Then, of course, as the member well knows, on May 8th, moved to additional public health restrictions that came into effect on Sunday at 12:01. We hope for a 3-week period. Outdoor gatherings limited to a maximum of 5. Restaurant, bar, patio closed to in-person but still takeout delivery. Gym and fitness centers closed, and I know that's a sore point for a lot of folks. Casinos closed, VLTs closed, museums, galleries, libraries closed, indoor community, cultural, and religious gatherings prohibited. Personal services closed. I should have got a haircut last week. Didn't. Now, like many Manitobans, I'm going to look like the member from Elmwood for the next month. No, but that wasn't due with hair. That was just age. That was an age joke. Okay. Dance, theater, yeah. Day camps closed. Retail stores, markets, garden centers able to open. I thought I saw the member for Elmwood on there earlier, and that's why I was referencing him, but he's gone now. I guess I could have said the member for St. Boniface. I see him there. So I'll just say, it's well-intentioned. I hope he isn't taking this to heart anyway. In any case, retail stores, markets, maximum of 100 people, malls open to a maximum of 10% of facilities capacity. So those orders, I think, if I'm right, are the toughest in Canada outside of Alberta right now, or is it Ontario? Ontario. So, again, the member's asking about putting hope in the window. Given the level of those restrictions, I think moving in another direction.
Honorable First Minister's time has expired. The Leader of the Official Opposition.
So I take seriously the Premier says work's ongoing, so maybe we could just switch to like a similar topic, but from a different angle, looking at it from the intergovernmental affairs side of things. One of the, I guess, significant restrictions, and I'd say justifiably so, but it's probably revisited on an ongoing basis, is the U.S. border closure. So I know the Premier is part of some conversations. I don't know how often that's brought up with the other First Ministers, but what's the Premier hearing about the U.S. border closure? What's the timeline for that? Is that something that's on the table later this year?
The Honorable First Minister.
Sorry about that, Mr. Chair. On the border thing, I just would use this time quickly to say a thank you to North Dakota Governor Doug Burgum for his cooperation and support in moving to get our truckers vaccinated. That was really appreciated. Governor Burgum has been a friend to Manitoba in every respect since his time began in office. And I just want to say a sincere thank you to him and his team. I think we're approaching on first vaccines. At the end of this weekend, we anticipate we'll go over 1,000 truckers that have been vaccinated thanks to North Dakotans. They're real partners with us. I know that the relationship between North Dakota and Manitoba has been an important one for many years, not always without acrimony. I remember Premier Dewar's Devil's Lake interventions and things like that, but nonetheless, there was, I think, a real fortunate thing that happened when he was just approaching his first campaign as governor. He decided to visit Winnipeg with his children and was touring the legislature and asked if he could see me, and that was great. It was a fortuitous circumstance because we hit it off, and I would say become pretty good friends. So he wants the border open as soon as possible. They're way ahead of us on vaccines. I'll Coles notes this because I remember we'll have other questions, but he wants the border open as soon as possible. He wants it safely open. He knows that we have to get vaccinated. This is a genuine offer, sincere offer that he's made. We're trying to expand that vaccine agreement because they have more and we have more people. I thought it would be a gesture of good faith to try to encourage teachers if they wanted to travel. It's 40 minutes down to that, 45. Depends where you are, obviously, to go down. My old union didn't like it, so it's not happening. That's okay. We'll look to others to avail them of the opportunity. But the point is that It varies so much to the Leader of the Opposition's question about reopening. Premier of Ontario has really, really focused on border challenges as part of what he feels wasn't addressed effectively by the federal government and hasn't been addressed. He's really focused on that. The Prime Minister has responded by saying he'll work with the Government of Ontario to assist. There's some room for argument about to what degree that is really the contributing factor in Ontario's challenges. It's, you know, perhaps 2%. Some studies have said less than 2% of their cases emanate from air travel. People of Windsor are already taking the initiative of trying to partner with the people of Detroit to, and Detroit is working in cooperation with them, I understand, to get folks from Ontario down to Detroit to get them vaccinated. There are numerous other projects breaking out around the country to see if we can't reopen the border, at least initially, to vaccine availability, because the U.S. has surplus vaccines available. We started that trend, I'm proud to say. Others have followed. Premier Moe and Premier Kenney have both launched trucking campaigns in coordination with North Dakota and Montana. So, you know, we're free traders in our relationship. You know, we don't just compete with the United States, we build things together, so we need each other. And so the flow of goods and services and opportunity between our two jurisdictions is essential. The sooner we can get the border open safely, the better. Not every jurisdiction has the same strong relationships that we do with a neighboring state. That's fair to say, and not every jurisdiction feels the same way about opening the border in the foreseeable future. But we know that the sooner we can get our vaccination, or this phrase we shouldn't be using, some tell me, of herd immunity, but the sooner we can get more people vaccinated, the better, clearly. You know, Governor Burgum and others, of course, throughout the United States want to see our relationship strengthened, not weakened. And as these border impingements continue, just the example of tourism, just that, which isn't a small thing, you know, in terms of revenue for our province. It's not a small thing. We depend on American tourists. We introduced a program for our
The Honourable First Minister's time has expired. The Leader of the Official Opposition.
So what are those discussions? Is that what's being said at that table then? Is it, yeah, it just depends on the vaccine rollout? What's the timeline for that being revisited?
The Honourable First Minister.
So it's a compliment, I think, to the federal government and to Scott Moe, who was the Council of the Federation Chair during last year, and Premier Legault is the Chair this year, that they have proactively made sure that we were in conversation, in dialogue. The member knows I've had to miss a couple of question periods I don't like to, you know. I mean, there's such a joy to be a part of, but to take calls from premiers, because we're in regular contact. I may have lost count of the exact number. I think we're over 30 calls with the Prime Minister so far. The Premier's dialogue has been more frequent. Probably we're at closer to 45 calls. With a group that diverse, there have been divergent views on a variety of things. The unifying thing throughout our efforts has been to continue the dialogue, make sure that we're talking to one another, make sure that we're sharing our views openly with one another. We've been unified on the health issue. Again, I'll say thank you to the opposition leader for his support and that of his caucus on fighting for health care. We fought hard. I'll give Premier Horgan the recognition here for leading that. I tagged along and helped as best I could. So we each called several premiers to try to lobby to get sick leave on the agenda. We did. We got the federal government moving on that. Premier Kenny and I were able to initiate changes to the wage subsidy program. I took on the initiative of trying to encourage the federal government to back up our lending processes early. You may remember this, but we were in a position where several provinces were having challenges borrowing money during the early days of COVID. We weren't quite there yet, but other jurisdictions were already there. I'll mention Newfoundland, Labrador. And so as a consequence of that, I was able to get, with the help of other premiers, of course, able to get the federal government to urge the Bank of Canada to float our loans, like to basically accept our bonds. This is really good because although we paid more than if the feds had actually done the borrowing on our behalf because their credit rating is lower, you know, or their credit rating is higher, so the interest costs were lower. We still got a savings out of that, put it that way. So that was an example of where the premiers pushing the federal government in that direction really helped. So it's a compliment, I think, to the Prime Minister and his team that they've allowed that dialogue to continue and that they have encouraged it. And their bailout package that they had originally proposed, premiers took very strong positions that needed to be strengthened and coordinated better than it was. We were able to get an increase in that proposal from Ottawa of close to 30% in the overall funding, and also increase the allocations on the municipal side. So we were able to support City of Winnipeg, for example, with much more available cash to go to them. And of course, municipalities across the country benefited by that. So these are some examples of where we continue to push. I look forward to continuing to have Manitoba lead on reducing interprovincial barriers to trade as we move forward. And so I appreciate the member raising the issue of international borders because it is equally important, perhaps even more apparent now that we have to get these international boundaries now that these international boundaries have been threatened, first with the free trade discussions and now with COVID. It's critical that we get these barriers internally out of the way. So, International Monetary Fund predicts that we can increase our GDP by 2 points, fully 2 points. What does that mean? It's about $1,500 per kitchen table per year in Canada. It's not small change if we can get our internal barriers down. So Manitoba, under our government, has led the way in reducing and eliminating those restrictions. We have very, very few left, the lowest in Canada. Alberta's moved in that direction under Premier Kenny. Good for him, but more needs to be done. This has taken a bit of a back seat during COVID, but it shouldn't, because as long as there are international impingements to our ability to trade, it should be used, I think, as motivation to get more and more of the barriers we create amongst ourselves through excessive regulation out of the way.
The Honourable First Minister's time has expired. The Leader of the Official Opposition.
Ask a question on behalf of my colleague from the Maples. It's a pretty straightforward question, just asking the Premier to look into something. It has to do with the Bridge Grant program, so I'm sure the Premier takes it seriously. Just, he's hearing from some folks. I guess we've received a few emails like this during the previous rounds as well. But he's hearing from some folks who bought a business or opened a new business at a time where they don't qualify based on the application deadline. I guess there's a balancing act there, right? You don't want somebody to just set up a business so that they can qualify for the Bridge Grant. But there probably is a way to balance that sort of accountability consideration with people who are legitimately, you know, starting a new venture or purchasing, taking over something. So I'm just wondering if the Premier can look into that issue and see if some consideration can be made for those folks who, because of some of the guidelines or the deadlines and some of the criteria, may not qualify, but who are legitimately actually starting a new venture or taking over from a different proprietor.
The Honourable First Minister.
Yeah, I know there's a mechanism for the member for Maples. I know there's a mechanism for businesses to appeal, and if we can get that information just let's make sure that information gets over to the member for Maples so that he can address that there at the riding level. That bridge grant is now $20,000 for those that applied on the first tranche. I don't have right in front of me the requirements to qualify. We made sure that it was relatively low threshold. I don't have in front of me the number of home-based businesses that are able to qualify. We'll get that. It's very significant. We broadened the program to include home-based businesses, nonprofits, charitable organizations, and so on. We are, and there are many other supports obviously besides these. We started with the GAP program initially, which was a non-interest bearing forgivable loan of $6,000. It had as criteria that it became a loan if you qualified for a federal program that was larger. We took that out on the bridge program so people could apply for other supports if they wished. The fourth round we announced May 10th, I think, also added a top-up for restaurants. This was in part, frankly, because that's one of the hardest hit sectors in our economy. And I should also mention we added an additional, it's not in my note here, but I think an additional $2 million to the restaurant support program to assist those that were converting to or enhancing their delivery and pickup services. This is in tandem with the fact that they could no longer serve inside, so clearly we felt they needed better supports. So that, I think, took that program up to $9 million. And I mentioned earlier the special programs for the hotel industry and for the, this is another hard-hit sector, obviously, the hospitality sector. So it's a pretty broad-based program. I don't think there's any perfect program, but what I have heard from my colleagues is it's not a lot of red tape. So businesses that had previously qualified for the first program got their $5,000, I'm told, within 10 days for Bridge 2. Bridge 3, it was within 5 days. Bridge 4, I was told when I announced it, everyone would have their check within that week, so that would be within 4 days. So the money is getting out. Each of these programs, of course, as they expanded with applicant numbers going up, what started as a, 40, I could have these numbers plus minus, about $47 million program. I think it's now more like 76 million because it's grown with each tranche. So, we've endeavored to make sure that we're doing as much as we can, wage subsidy programs, promoting. We hired a company to help answer questions that would clarify for our business community where they should go to apply. Educated them on various programs like the Back to Work program, the Summer Student Jobs program. Took the provincial, bridge supports over 286 million as we speak. So pretty significant supports that stand up awfully well against any other province's programs. So always important to recognize that this isn't easy street. We're not making businesses stronger with this. We're hoping that we can make them less weak. I guess that's the point, to help them hang in there and get ready for recovery as soon as possible. So with other programs, we took the provincial sales tax, of course, off property insurance. That had been added by the Sellinger government in 2012 budget, and that came off. So that was not small, because of course property insurance is a necessity, and then you add that 7%. Well, it was 8 when they raised the PST, and then they added the property insurance. So property insurance didn't go up 7, went up 8.
The Honourable First Minister's time has expired. The Leader of the Official Opposition.
Just wanted to ask a couple of, maybe we call them mop-up questions, just sort of like detail-oriented stuff about executive council. It's stuff that the Premier has undertaken in previous years, so maybe I'll just kind of go through it kind of quick. I'm just wondering if the Premier can undertake to provide an org chart for executive council, a staff listing for executive council, and a current list of all the technical officers in government.
The Honorable First Minister.
I'll get to that. An earlier question, and I just got handed the information here on the borders issue that I didn't really fully address for the member. So I got acronyms in here, CBP, Canada.
Canada Border Security, CBSA.
That's CBSA. What's CBP? Is that the U.S.?
Customs and Border
That's Customs and Border Patrol. Thank you, thank you. Former Foreign Affairs critic, I should be able to handle acronyms. That was the Department of Acronyms. Oh my goodness. So they're in discussions as we speak on reopening the Canada-U.S. border. The border restrictions are expected to be rolled over for another month, June 21st. As I alluded to earlier, there's variation among the premiers on the degree to which or the rapidity of which they would like to see these happen. I would say, quite frankly, that generally speaking, the Western premiers are somewhat more in favor of opening our borders sooner than later. I think that would be a fair observation. I should let those premiers speak for themselves, though, but I share this with the member as an off-the-record comment. How's that? Currently, only Canadian citizens, permanent residents, and their immediate families are able to travel to Canada for non-essential purposes. Permitted travelers are subject to federal requirements. This is the 14-day quarantine, as the member's familiar with that. Producing a negative PCR COVID-19 test taken 72 hours before entering Canada. Taking 2 additional PCR tests, the first upon arrival in Canada and again on day 8. Air travelers are also required to stay at a federally designated hotel at their own expense while waiting for the results of their arrival test. And in addition, of course, Manitobans know that we have required throughout travelers to self-isolate for 14 days. We started nationally, we lessened that to allow Western Canadians. We now have everybody 14 days. So that's a quick overview. I can say that all the information that the member requires will be in the estimates for my department, and that'll come out, I think, in a couple of months. So there'll be all of it in there. And the only reason I've provided this every year, this is COVID right now, and I'm trying to let everybody do COVID work as much as possible. So I hope the member will indulge me in that this year, because I don't want to give too many extra tasks to people that are in the midst of some of the craziest work demands they've ever had. Okay, so he'll get all the information. It'll be forthcoming, I expect, before the fall session. Could we assure that? During the fall session, October? I'm putting these guys on the spot for you, you know.
Formally, it's before the end of the sitting session. That's the period.
We'll endeavor to get it there during the fall session, so the member has all that information. I can tell them that it's not much different than it was. There might be a couple of staff changes. The overall budget remains significantly lower than it was under Premier Selinger, we'll put it that way. So that's flat or down. I would say on the technical staff side, we remain about 20% lower than the NDP technical staff salaries that were in place under the previous government. So still continuing to endeavor to reduce expenditure at the top of the organization and support our front line. I wanted to finally got this info on the report on wait times. I thought the members might be interested in this because it is going to be, with this pandemic, there have been so many people that have had their surgeries delayed, so many people have had their treatments deferred. This is a truly pandemic pileup. You know, we had wait times before that were big. This study was done just prior to the pandemic. So what I'm sharing with the member, I will say in advance, is done.
The Honorable First Minister's time has expired. The Leader of the Official Opposition.
All right, thanks, Mr. Chair. So let me try a different undertaking then, I guess. Just try and get some more details here. Can the Premier undertake to provide a list of all employees who are currently seconded within executive government and within other departments of government?
The Honorable First Minister.
I'm just waiting for some assistance from my clerk in respect to that. So I'll just simply say the pandemic has resulted, not obviously just here in Manitoba, but across the country in a massive additional problem, which is going to cost lives and is costing lives right now. And there are increasing reports, Doctors Manitoba, other organizations, of situations that are where health is deteriorating as a consequence of people not being able to get treatment or care. And this concerns me greatly. My sister didn't die of COVID, but she and many others who had cancer had real impacts to their treatment and care as a consequence of COVID. And I can only say that this is an issue where that is, although not new, wait times, according to Kevin Page's group, the average wait in Canada for priority surgeries prior to COVID. This study was done a year and a half ago, a little more than a year and a half ago. Wait times, the average national wait time, for example, in 1993 was 9.3 weeks. 9.3 weeks. The average wait time when the study was done was 20.9. And that was before COVID. Total wait times have gone up in every single province, from referral to GP for treatment, from referral to GP to specialist. Massive, massive increase. Time between referral, yeah, this is overall. Time between referral and visit to specialist is the first segment. That's the main driver of longer wait times. Wait times in that segment are 173% longer than they were in 1993. And the wait times for the second segment, which is between specialist and treatment, are also longer, 92% longer. So that's before COVID. This is an issue of awesome importance, and we can't do this alone. No report says that we can possibly do this alone. As provinces, I speak for all provinces, even Ontario can't possibly handle this. This is, I don't know of a bigger problem emerging post-COVID than this. This is, the example I gave the Prime Minister was of a woman who had a lump, went to her GP, waited. Every day was hell. Every day was fear. Little kids. Goes, finally, gets a test. Waits again. Waiting, every day, not knowing. and goes finally to get the test result back and sits with her husband opposite the specialist, and he says to them, "Too bad, we couldn't have got to this sooner." Wow. I told the Prime Minister that's a true story of a Winnipeg couple I know, friends of mine. And he looked at me and he said, "I'm not your banker." Well, thanks, guy, you know. Healthcare is a shared responsibility. The funding for it is his.
Order, please. The hour being 12:30 PM, committee rise.